Welcome back to Midday. Dr. Benjamin Dunkley from Envision Cosmetic Surgery joining me now, and we are tackling the cosmetic surgery controversy.
Yes, we are.
A lot of people talking about this right now, and in the news, so many celebrities weighing in on how they feel about it, but then you see what they look like, and you wonder if they're telling the truth.
You do, and most of them aren't.
Okay.
I think there's some areas that you can tell for sure where they've had at least a few things done.
All right, so should we take a look at two of those that have talked for and against this, Jennifer Aniston and her friend Courtney Cox?
Right. And Jennifer Aniston has been against it. Courtney Cox was for some minor things and then has recently come out and changed her mind and is against now. But in the past, Courtney Cox has had some fillers, which really are reversible. They eventually go away, so probably don't leave any long-lasting results.
So her issue was, and I remember her interview saying, I didn't look like me. Do you hear that sometimes when patients visit other doctors and they come to you and say, I want to look more like myself?
I really never hear that. Honestly, if it's done right, we should be able to just enhance your looks without changing them dramatically.
All right, so let's talk about Renee Zellweger. When you say change dramatically, she also said, I didn't undergo anything, but so many people questioning if that's true or not.
Yeah, she came out not long ago and looked very much different than she had in the past. And I think you can tell from the pictures that she's had a few things done.
So then we have Farrah Abraham, who actually boasts about it. She's had her third breast augmentation. And Kim Kardashian is usually very open about what she's having done.
Right, right. And they definitely are for cosmetic surgery, and they're plenty open about it. And of course, I'm a proponent of cosmetic surgery because I'm doing things myself. And you're not trying to change your looks, you're just trying to maintain.
So many of us out there are obsessed with cosmetic surgery and the shows, whether we say we like it or not. Botched and Dr. 90210. These are popular.
Oh, they're so popular. And they're so fun to watch. You watch them, they're very engaging, and it's fun to see the changes and the dramatic things that can be done.
Okay, now speaking of dramatic, there have been people who have taken it to the extreme. And I know we have some pictures of those as well. We have, you know, your Kenny Rogers and your Joan Rivers and your Michael Jacksons.
Definitely.
Should these have happened?
No, definitely too much done. Not a good approach to surgery. They're doing too much when they should have stopped, or they're trying to do too much in one surgery.
So as a cosmetic surgeon, Dr. Dunkley, how do you help steer your patients in the right direction?
Well, it's first important to sit down and actually find out what your goal is. What do you want to do? Do you want to look 10 years younger? Then we're thinking a facelift. Are you trying to just get rid of a few little lines here and there? Then we're thinking fillers. So it definitely depends on a patient's goal. And if we can come up with that goal, we can tailor a plan to them that will keep them looking like themselves, but a little bit younger.
What's the most popular thing that people are asking right now from you?
So surgery-wise, breast surgery is always the most common. But on the procedure side, we're definitely looking at Botox and fillers. Fillers are so common. It's really nice to fill the lips up a little bit because part of the aging process, we just lose fat and volume where we need it. So we're losing volume in the cheeks, and our cheeks deflate. We're losing volumes in our lip, and our lips deflate. So it's nice to add a little bit of that volume back.
What I appreciate about Dr. Dunkley is he's not interested in doing a procedure for you that everybody's doing. You actually want to know what that patient needs and what they see when they look in the mirror.
That's exactly right. My goal, I tell every patient, is to have you be happy when you look in the mirror. And for some patients, that's a dramatic change. And for some patients, it's a little change. But whatever it is, we can help them out.
Envision Cosmetic Surgery, everybody. If you want more information, go to our website. Go to good4utah.com/midday. Their website there too, envisionsurgery.com on your screen along with that phone number. Dr. Dunkley, thank you so much.
You're welcome.
Emily and Brian, back over to you.